My name is Michael Herzog. I'm a board-certified urologist and a fellow of the American College of Surgeons. So I get a lot of referrals for stone disease. Not just stones, but I do a lot of the advanced stone. Stone, they have done multiple studies. Stone pain has been rated worse than women giving birth without an epidural, men being shot or stabbed. It is rated as one of the worst pains you could possibly have. So in the old days, you'd have a cut hair to hair. I do it all through an incision like this. A lot of these minimally invasive techniques allow you to get rid of the problem and the patient goes home the same day. It really has changed. So I always send every stone off for a chemical analysis, so we break it down. Now, if you said, doctor, what stone do you think I have? Well, of course I gotta be smarty and say it's calcium oxalate, because 85% of stones are. The thing is, there's a couple different versions of calcium oxalate stones, but most specifically, there's probably 10 or 15 ways to make the same stone. So you could be the technician to get rid of the stone, but you have an underlying metabolic disorder. And if you do not address that metabolic disorder, guess who's gonna get stones? Again, and again, and again. And the people don't realize that once your body figures out this little secret. I always give them the example of you play a song on a piano. When you first get the song, you're terrible at it, right? But the more you practice, the better you get playing that song. Same thing. The more stones your body makes, the more efficient it gets at making them. And so if we don't do a complete metabolic workup, which involves blood tests, urine tests, imaging, over a long period of time, your risk of getting more and more stones is extremely high. So it doesn't end with just treating the stone. My job is to break down, how did you get to that stone? I know that at the end of the day, you have the same stone as your neighbor, but you probably didn't get there the same way as your neighbor. So that is part of the whole thing of analyzing the stones and analyzing you and putting the pieces together.